Good afternoon, Harmon Noy. I'm Mihiraa. Let's begin your warm-up sessions. Can you describe your nursing education background and how it has prepared you for this role?
I completed my Bachelor of Science in Nursing from Central University. During my studies, I gained a comprehensive understanding of nursing theory, clinical practice, and evidence-based care. Additionally, I participated in several clinical rotations, which provided hands-on experience in various healthcare settings, including medical surgical units, pediatric wards, and community health clinics. This education equipped me with the knowledge and skills necessary to deliver high-quality patient care and collaborate effectively within interdisciplinary teams.
How do you stay updated with the latest advancements and best practices in nursing education?
Continuous learning is crucial in the field of nursing. I actively engage in professional development activities, such as attending conferences, workshops, and seminars related to nursing education. Additionally, I am a member of professional nursing organizations that offer resources, webinars, and publications on the latest advancements and best practices in the field. Moreover, I regularly participate in online courses and discussions to stay abreast of current trends and evidence-based strategies in nursing education.
What strategies do you employ to accommodate diverse learning styles in your teaching approach?
Recognizing that each student has a unique learning style, I employ a variety of teaching strategies to accommodate diverse preferences and needs. For example, I utilize interactive lectures, group discussions, case studies, and hands-on simulations to cater to auditory, visual, kinesthetic, and tactile learners. Furthermore, I encourage active participation and feedback from students to ensure that the learning environment is inclusive and conducive to their individual learning styles.
How do you assess student learning and evaluate the effectiveness of your teaching methods?
Assessment plays a vital role in determining student progress and the effectiveness of teaching methods. I utilize a combination of formative and summative assessment techniques to evaluate student learning outcomes. These may include quizzes, exams, practical demonstrations, case studies, and reflective assignments. Additionally, I solicit feedback from students through surveys and discussions to identify areas for improvement and adjust my teaching strategies accordingly. By regularly assessing student performance and soliciting feedback, I can ensure that my teaching methods are effective and aligned with the learning objectives.
Can you discuss a challenging experience you encountered in your nursing education career and how you addressed it?
During my nursing education career, I encountered a challenging situation when some students were struggling to grasp complex concepts in pharmacology. To address this issue, I organized supplemental review sessions outside of class hours to provide additional support and clarification. Furthermore, I collaborated with colleagues to develop interactive learning resources, such as flashcards and online quizzes, to reinforce key concepts and enhance student understanding. Through these efforts, I was able to facilitate the learning process and help students overcome their difficulties in pharmacology. This experience taught me the importance of flexibility, collaboration, and proactive intervention in addressing challenges in nursing education.
You can now start your OET roleplay.
Good afternoon, Mihiraa. It's good to see you again. How have you been since your last visit?
Good afternoon, Nurse Harmon. Thank you, I've been okay, but my migraines have been bothering me again.
I'm sorry to hear that. Can you tell me more about the symptoms you've been experiencing?
Well, they've been coming on more frequently lately, and the intensity seems to be getting worse.
I see. Have you noticed any specific triggers that might be contributing to the increase in migraines?
Not really, Nurse Harmon. It just seems like they come out of nowhere, making it hard to predict when they'll strike. But honestly, I feel like I'm barely surviving these migraines with the current dosage. I need a higher dosage to get through these migraines.
Mihiraa, I understand how challenging it must be to deal with migraines that seem to strike unpredictably. It can feel overwhelming, and I truly empathize with what you're going through. However, increasing the dosage of your medication isn't the best approach for a few reasons. Firstly, altering your dosage without proper guidance could potentially lead to more severe side effects or complications, which might exacerbate your symptoms rather than alleviate them. We want to ensure that we're treating your migraines effectively while minimizing any adverse effects on your health. I would also like to reassure you that your current dosage is carefully prescribed to provide relief while minimizing the risk of side effects. It's about finding the right balance that offers you the most relief with the least amount of discomfort. So let's work together to explore other strategies that can complement your current treatment plan and provide you with the relief you need. Your well-being is our priority, and we're here to support you every step of the way.
But I thought increasing the dosage might help alleviate the migraines more effectively. I'm having trouble understanding the reasoning behind your response.
I completely understand why you might think that increasing the dosage could provide more relief. It's a common assumption, and your concern is valid. However, it's important to consider the potential consequences of altering your dosage. When it comes to increasing the dosage of your medication, there's a risk of experiencing what's known as rebound migraines. These are headaches that can occur as a result of overuse of migraine medication, and they can actually become more frequent and intense with higher dosages. Additionally, increasing the dosage could potentially lead to an escalation in headache frequency and intensity, rather than providing the relief we're aiming for. I want what's best for you, Mihiraa, and that means finding a treatment plan that effectively manages your migraines while minimizing any additional discomfort or side effects. Let's explore other avenues together to address your symptoms in a way that's safe and sustainable for your overall health and well-being.
All right, I hear you, nurse. I hadn't thought about that. What else can I do to manage my migraines better?
I'm glad you're open to exploring other options, Mihiraa. There are several lifestyle changes you can incorporate to help manage your migraines more effectively. Firstly, maintaining a consistent sleep schedule is crucial. Aim for 7 to 8 hours of quality sleep each night, and try to go to bed and wake up at the same time every day, even on weekends. Secondly, managing stress is essential. Stress can be a significant trigger for migraines, so finding relaxation techniques that work for you, such as deep breathing exercises, meditation, or yoga, can be beneficial. Additionally, staying hydrated is important. Dehydration can exacerbate migraine symptoms, so be sure to drink plenty of water throughout the day. Lastly, pay attention to your diet and potential trigger foods. Certain foods and beverages, such as aged cheeses, processed meats, caffeine, and alcohol, can trigger migraines in some people. Keeping a food diary can help you identify and avoid these triggers. Remember, Mihiraa, these lifestyle changes may not provide immediate relief, but over time, they can significantly reduce the frequency and intensity of your migraines. I'm here to support you as you make these adjustments, and together, we'll find the best approach to managing your migraines and improving your quality of life.
That makes sense. I'll try to incorporate those changes into my routine.
Great to hear, Mihiraa. Remember, managing migraines is often about finding a combination of strategies that work best for you. If you have any concerns or questions, don't hesitate to reach out to me.